In 2003, when scientists successfully mapped the entire human genome and unlocked a scientific and medical achievement that also unlocked a new class of healthcare workers that we now know as genetic counselors. Here today to talk with us is my dear friend and now colleague, Elizabeth Turner from Advanced Tele-Genetic Counseling. Elizabeth, it is so great to have you, and I'm really excited for this conversation this morning.
Thanks so much for having me, Alice. I know this has been a long time coming, and I'm really looking forward to just getting a chance to chat together today about the exciting things going on in the fertility market as a whole and also in the genetic counseling arena.
So let's kind of start there with genetic counseling. How did you know you wanted to be a genetic counselor? It's such a brand new field. What was that pivot moment for you that went like, I want to go into this field?
Great question. Yeah, so I come from a really rural area of the Midwest originally, and genetic counselors were not accessible or widely known, at least in the community where I grew up. And I realized it was a challenge to find genetic counseling support, even at that point, and wanted to find a way to help those individuals who needed genetic services to get them. And with the advent of telemedicine, we've been able to do that in ways that were previously more difficult.
It's really interesting to look at kind of this intersection of genetic counseling being brand new. Telemedicine really started in rural communities. I know even from my oncology background that that's how patients were getting, daily support when they were going through oncology treatment. They'd have to drive quite far to get an infusion, a chemotherapy infusion, but then have the support in between of telemedicine.
Sure. Yeah. And that's the problem, especially for the oncology patients. There are so many medical appointments to attend, and the risk of exposure, of course, increases every time they go to a medical facility. And so there's a lot of reasons why telemedicine can be helpful for different individuals. And for oncology patients, I think just that the ability to rest at home while you're still getting the care you need is a really useful application of telemedicine, and especially for something like genetics, where when we're speaking with a cancer patient, we probably don't need so much of a physical examination. It's more based on the conversation that we're having with the patient, their personal and family history, in conjunction with their physician's notes about that patient, of course. And so it lends itself really well to the telemedicine sphere, and beyond that, I think has application for fertility as well.
Well, and that's one of the big areas where genetics has been so incredibly helpful, because it's allowed for personalized, quite tailored cancer treatments, and also kind of risk assessment, right? So in the case in my family, we had family history, both breast and colon cancer. So my mother and I participated in a genetic research study at UCLA prior to me even being diagnosed. And one of the most valuable things that I got out of it was the family tree, where somebody else was doing my family tree and, coloring in all the different people throughout the years who have had cancer. And then, of course, a different view of those who passed from cancer and complications versus, those of us. My mother at the time was already a cancer survivor. And so when I was diagnosed with cancer, that was the first phone call I made. It was the genetic counselor who was managing that project. And I said, you have to color in my circle, so I felt very fortunate that I already had a relationship, because quite frankly, I wouldn't know how to navigate it otherwise. And at the time, the BRCA test was also still relatively new. I mean, they were still operating under a patent, right? So that's how new it was. So walk me through a little bit of, what people can expect actually when they take that first genetic counseling call, and kind of clarify what I'm talking about with this family tree. And hi, Sylvie, it's great to see you. A fellow, cancer survivor friend of mine who loves seeing her oncologist. I did too.
Yes.
But we're not pushing it at all, Sylvie. People have to drive 4 hours in rural communities. This is why telemedicine is valuable, so we don't expose people with reduced immunity. It's a very real thing that's where it really did start, because people couldn't access an oncologist because they weren't in a major city. So talk to us a little bit about what that first appointment, is like for somebody who's first, getting experience with a genetic counselor.
Sure. So the genetic counselor will probably ask you, more than likely before your appointment, but sometimes during your appointment, about your personal and family history for the first time. And it may seem like a lot of information that you're providing, but it's all very useful for the genetic counselor, because the genetic counselor is trained to look for certain red flags that may come up in a personal or family history. And they may ask you some sort of seemingly obscure questions about head sizes and about, ages at death and things that we're just not usually talking about in our daily life. So good to understand that at the offset, that this is a very personal conversation that patients are having with their genetic counselor. But the genetic counselor is really, the point of all this is to take a look, like a zoomed out picture of that personal and family health history. And this goes back multiple generations, 3 is standard, to assess all of the blood relatives in the family and to look for those little clues or nuances that might indicate some sort of genetic predisposition for whatever indication the patient presents for genetic counseling, whether that's for help with fertility or for cancer or for cardiac conditions that run in the family. I mean, it can be a whole host of things. So the genetic counselor will be looking at that family history through a very fine lens to try to see what exactly, if anything, is going on in the family that seems suspicious of a genetic component. And from there, if there is something that may be indicated, the genetic counselor will then take time explaining genetic testing options with the patient, which is usually very individualized for that particular patient, because we all have different genetic information. We all also have different genetic needs as far as what we may be predisposed for and what we may need to know more about. And so that's where the conversation gets very personal about, this is what we think your risk may be based on this personal and family history. And here are some options if you want to pursue genetic testing. These are the next steps. And I think it's also important that patients undergo genetic counseling, and many of them do move forward with genetic testing, and some also do not. So genetic counseling, that's not like the end goal is not genetic testing by any means. It's just supporting the patient with the information about their own health and their own genetic factors to help them make whatever decision is best for them in that moment.
Right, I got that. And that can be in oncology care, that can be in fertility care. So in our world with FertilityAnswers, we're advocating, patients do preconception genetic counseling so that they can assess whether or not carrier screening and what type of carrier screening makes sense for them. What does carrier screening even mean? Let's at least clarify that.
So all of us are expected to be carriers of around, I think, 5 to 8 recessive genetic conditions. So just like the average person off the street. So we all have DNA changes within us that are different than what we would expect to see. It's what makes us unique human beings. Most of the time, those changes don't influence our health, but sometimes they do. And carrier screening takes a look at both partners, whatever the family structure is trying to conceive a pregnancy. They're going to take a look at both the egg and the sperm, whoever that individual may be, and take a look at what's going on in those families. And there are tests that test for a host of what are called recessive conditions, which is what carrier screening looks at to see if the pregnancy that we're discussing has an increased risk for any certain recessive conditions.
Interestingly enough, I have a donor-conceived son. That's no secret to the world. He and I are both very open about it. And when I was about to embark on my embryo transfer, I had to have another genetic counseling conversation with the sperm bank that I selected a donor from. During that conversation, they let me know that unbeknownst to them at the time of his collection and donation, which was years prior to when I did the transfer, because I had done fertility preservation, I didn't use those embryos for 5 years. They were, locked safely in a freezer. And that conversation, what we talked about was that there was a genetic hearing loss condition that was determined in the donor. Because in the donor conceived world, we weren't doing genetic testing years ago. And then as genetic testing has improved and as the prices have dropped, now a lot of, donor banks, egg donor banks, sperm donor banks, and just the whole donor conceived world has expanded the access to genetic screening as well. And so I had to decide, do I want to proceed with this transfer that I was already doing my injections for, or do I want to pause and see if I'm also a carrier? Now, I couldn't make any new embryos. So that's why, I went forward and had to take that risk, and everything worked out great. My son, doesn't have any hearing issues. So these are some of the areas in reproductive health in which we can actually utilize genetic counseling. I would love, Elizabeth, for you to talk about why genetic counseling and kind of the whole arena of the healthcare system is so critical. And what I mean by that is that this is still very new. 2003 was not that long ago. So we don't have a new wave of physicians who had any kind of genetic training when they were in medical school. They didn't do fellowships in genetics. There are some MDs who were young enough to also do PhDs in genetics. There were some MDs who switched courses and actually went, PhD track. So how does that fit into the healthcare system in sort of like a collaborative model?
It's a really interesting point that you bring up. And a lot of what we are dealing with as genetic counselors, and then beyond that, the geneticists who are in the field, I think is this great amount of information that's coming at us so quickly. There are multiple genetic tests that are being developed every day for pretty much anything you can imagine. And so the field has changed since I was in school, which wasn't all that long ago till now. And I think it's becoming more and more important for genetic counselors to be able to interpret the information that they're being given, even if they haven't necessarily seen the same indication in another patient. And so I think we're gaining flexibility. I think genetic counselors are really fortunate also because we are a small number, and so we have a very good community. And I've seen genetic counselors leaning on one another for, support. I haven't, had a test from this lab before. Can anybody tell me anything about it? That's something that we've dealt with in the field recently. It's just a whole lot of new players. And so I think the long story short is it's ever evolving, but it's becoming more important than ever to have those discussions, for physicians to have those discussions about family history of patients, because now more than ever, the flip side is that we can know more, and eventually we'll be able, hopefully, to do more about the information that we uncover. So while there may be recommendations for certain genetic findings that are more typical in nature, there are also more things that we're seeing that we just don't know what it means yet. But one day, we will. And I think reclassification is one of the beautiful things that's going on, like in the genetics world as it becomes more open. And I think that also highlights the importance of sharing our information that we have as far as what we're seeing in our patients and other patients, through databases and those sorts of things that can really help others who may find themselves with similar genetic findings.
Mm-hmm. Well, one of the advances in reproductive medicine that I'm very excited about is IVF with PGD. So if someone does have a family history of certain medical conditions that can be really devastating from a childhood disease perspective, and we have preventable deaths, we have preventable suffering thanks to science. And if someone does, learn that cystic fibrosis is a likely outcome for instance, that is something that with IVF with PGD, we can do embryo selection to select embryos that are not positive for cystic fibrosis. Now, I will say that it still is a highly debatable, it opens up a whole world of kind of bioethical conversation. So we're not going to dive into that today, but it is something that is an exciting advancement, because certainly the ultimate dream for those of us who do want parenthood is that we want healthy children. And, that is where all of this, does uncover the option for that. And that also includes, using genetics to reduce the risk of miscarriage. We're able to use genetics in the world of reproductive medicine to assess things like recurrent pregnancy loss risk and even, gestational diabetes risk. Genetics does play a role in kind of understanding all of that so that people can make lifestyle changes. I always like to say, Elizabeth, to everyone that genetics is not a life sentence. It's really powerful information, right? That can help us make great lifestyle choices, diet choices, exercise choices, all kinds of things.
It's definitely powerful information, and what we uncover in our genes or what we uncover in the genes of the embryos that we may be discussing, I think the take-home message is what's right for one person or one family may not be right for another. And so having the information accessible doesn't necessarily mean that you have to, make another choice. Like in the example that you shared, you made the choice to move forward anyway. And there are plenty of people who would make that choice for a whole lot of different conditions. But what it does allow people to know is how to prepare for that. So if there is a concern, for example, after birth, that the physicians and the team who's caring for that child will know ahead of time, this is how we can provide the best care. And so,
right.
I think the applications of genetics are as far-reaching as we can imagine, because they affect every system in our body and literally help make us who we are in these human forms. And it's my thought that over time it's just going to become more and more important and more commonplace to know about our genetic information, and then to be able to use that information, hopefully, to live healthy and happy lives. And like you said, it's certainly not a sentence. It's actually, I like to think it's just our story. It's the storybook of who we are.
Yeah, it's like the fabric.
Yeah. And we all have a unique one to tell. And I think that really is the beauty of genetic support, is helping patients and individuals who seek genetic counseling to be able to read their story.
Well, I am happy to announce that yesterday was your 4-year anniversary of ATGC's own history and story, so congratulations on an incredible milestone. And if you do want to connect, we do have ATGC as a live partner on the Fertility Answers app platform, so you can ask a wonderful team of genetic counselors any kind of question that you have right from the platform. You can also find them on our website, and on their website. We'll include some links for you in the comments below. Elizabeth, thank you so much for joining us today. Apologies for the brief interruption by my own genetic miracle. He popped in and wanted to know where his play date was. As always, we'll see you guys online, and thanks so much for being part of our community.
Thanks, Alice. We're looking forward to seeing what is to come. I appreciate it.
Everybody, have a great day.